This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good, Amy. How are you doing today?
I'm good. Are we going to talk about why I'm not wearing my scrubs?
Yeah, I mean, it's a little disturbing. I'm wearing my scrubs. I'm ready for the podcast.
I'm just like casual in a lab coat and a t-shirt.
Yeah, what's going on?
I know. It's just a fun day in the office.
Yeah, I got you.
Yeah. So today we're doing a 2.0 episode. So it's an episode we've done before, but we actually found out that we did have a video of it, but it's a video of you and I kind of sitting awkwardly at the end of a table.
Yeah, it's not good.
Yeah, with no slides. So we love it.
I mean, it's like borderline embarrassing, episode 36. But it was a good episode.
Yep.
What we talked about was good. And this is before Nils convinced us to go into an actual room, film it correctly, and obviously we have to redo this. With that said, we do have some things to add to this episode. This is not just redoing it for video purposes.
No, but we're talking about blepharoplasty or eyelid surgery today. So if you would like to see the slides, because there are slides that go along with this podcast, you can find those on YouTube at Jason Martin MD on YouTube. And you can also follow along on Instagram. We're at Beauty and the Surgeon podcast on Instagram. So there's some fun slides today, and you won't just have to imagine in your mind what we're talking about. We can actually have pictures and can show you. So
we were talking about blepharoplasty, eyelid surgery, eyelid tuck. What are some of the other names for the surgery, Amy?
I think that covers it.
Does that cover it all?
Mm-hmm. You know, what's funny is eyelid tuck was one I hadn't ever really heard people saying until more recently. Like eyelid tuck, like where are you tucking them? Like where are you?
You just tuck it away.
You just tuck it away. Like, I mean, isn't that what your eyes do when you open? I mean, essentially that's just opening your eyes.
Yeah.
You are eyelid tucking or blinking.
Right.
You're unblinking.
Very good point.
Can we unblink? So.
Yeah, where are you tucking it to? Because tucking is like sheets.
Right. Or like pulling it around something, but you're not. So if you are interested in finding out more about blepharoplasty.
So if you want, like when people talk about getting their eyelids done, that's what we're talking about today. All right.
Yep. We're going to talk about getting your eyelids done. So let's first start out with the types of eyelid surgeries and we're talking primarily for cosmetic purposes. Some of these do have a functional component as well.
There are a few surgeries that we do that have a cosmetic and functional component. Okay. Breast reduction is one of them. That's functionally can improve people. Paniculectomy or removal of skin and soft tissue of the belly after massive weight loss.
I would say any surgery done for massive weight loss, meaning like excess skin removal, could be functional.
Right. And definitely eyelid surgery for sure. So if anyone can remember a grandparent and you've seen an older person that has those eyelids that go over their eyelashes, basically onto their eyes. Mm-hmm. Like there's no way that they're being able to see it from a peripheral vision standpoint up or over. And so functionally you can improve people's vision. You can give them a better field of view when they look forward.
Yep. So in really breaking it down into three basic categories are going to be an upper eyelid blepharoplasty or an upper eyelid surgery, lower eyelid blepharoplasty, and then a combination. Now, both of those upper and lower can be done in a couple of ways, removing just the skin, or in most cases, removing skin and fat. You can also, for the lowers, remove fat only. So a couple different ways to go about it depending on what your presentation is and what you're kind of trying to address.
Yeah, so crepey skin's a problem. Fat's a problem. You know, it's a redundant theme in all these episodes we're doing. We're either tackling the loose skin or tackling the fat or both. And in most cases, it's both. And you can see that if you're someone who's aging and as opposed to someone who's not aging.
Right. If you're not aging, please call us.
Whoever that person that's not aging, we would like to interview you and also start a company with you.
Drink your blood.
Yeah. If people, as we get older, you see the changes in your eyelids is one of the first places And I'm sure Amy and I will talk about that. So you can get loose skin and fat there, and usually it's both, and that's what bothers people.
Yeah, so that when you talk about having somebody having their eyes done, just know that there's a lot of things that might involve. So there's big question for all of these then is, well, where does the incision go? And that's probably the most common question.
You just tuck it away. Tuck it away.
You just tuck it. Tape. So this is a great picture that does kind of have like a little dotted line that shows the two primary places you would make an incision. Now, the one thing it doesn't do a good job of showing is that for the lower eyelids, you can make an incision on the outside of that lower lash line.
Where your crow's feet is.
Well, or like right underneath where your eyelashes grow.
Yeah.
Or you can actually make that in a similar place on the inside of the eye. So just kind of pulling that eyelid out a little.
Right.
And you make a little poke incision just inside the eye.
Right. So that's called transconjunctival. And that's how I do a lot of my surgeries. If you only have fat on the lower eyelids, and that's common on younger people, when I say younger, I mean 30s and 40s, who are struggling with the appearance of their eyes, I can just do all the incision from inside the eyelid, the lower eyelid, transconjunctival approach. Most of the time people need skin surgery too, and that's an incision underneath your eyelashes. I like how to the camera I'm telling everyone what to do here at this point, and we're on a podcast, but that's okay. Underneath the eyelashes and onto the crow's feet. Yeah. Those heal amazingly well, just so you know. The upper eyelid incisions involve a crescent-shaped incision, which removes the excess skin in that area, and then you close it, and the scar ends up in the crease of your upper eyelid.
Yep. So when your eye is open, it's invisible. And we have some pictures that we'll show later. But really, the scars from a blepharoplasty are pretty much completely hidden, and they do heal very quickly. Eyelid skin is very thin and very delicate.
What do I always say? What did I say?
Thin skin, thin scar.
Thin skin, thin scar. I'm getting T-shirts made up today.
Probably
Nils, get on it.
Nowhere is that more true than on the upper eyelids, I think. I mean, talk about like some of the most delicate skin on our bodies.
Yeah.
It is really
which is the reason why you can see aging there first. So people with thicker skin age better. People that have a Mediterranean descent, people that are of African descent, South Americans, they have thicker skin. They have thicker dermis.
More melanin.
More melanin and thicker dermis. And the melanin protects them from the sun rays. But on the eyelids, especially in lighter skinned people, that's where you see the effects of aging first. And that's the most common procedure, facial procedure we do probably. That's because not only do some people that are older in their 50s and 60s come in for that, but people that are in their 30s and 40s. So it's a big net of people that we capture. It
is. And I think it's really a surgery that kind of gets a bad rap as far as most plastic surgeries go. In fact, last
Kenny
week,
Rogers.
Right?
Sorry.
No, I actually Kenny Rogers is one that always comes to my mind, but I had a patient say, I'm not going to look like Nancy Pelosi, am I? I'm like, oh my gosh, no. Like she has...
You had to get all political.
She has the thyroid
in the
disorder.
middle of the political season.
No, well, she's young, so she's too young to say,
yeah, so anybody that goes from that almond-eyed appearance to that round-eyed appearance, it's alarming. And, it's unfortunate because that's over-aggressive surgery. Or some people do have medical conditions that cause that, like Graves' disease is one of them. That's a thyroid condition that causes something called proptosis, where the eyeball tends to stick out further.
Get that buggy-eyed look.
Bug-eyed appearance. Yeah, but that's like a sine qua non. I mean, like when you see someone like that round-eyed appearance, your first thought is they have plastic surgery.
Which it might be, and it might not be.
Yeah, it might not
be. I think a lot of people...
They could have had skin cancer.
Yeah, or something else. Or maybe they had surgery and then they got a thyroid issue. So like maybe their surgery was fine. So yes, they had surgery, but then they also have some thyroid dysfunction and they're having a little bit of a bulging of their eyes, or they have, some crazy other thing happen. So that's one thing that I didn't make a slide for that I probably could have thinking on it now, is talking about the musculature of the eye. Because that really is, the eye has a lot of muscles. Obviously, they control it. Yeah. Like so the eyeball itself, but then also around the eye, has a lot of muscles. The orbicularis oculi.
The orbicularis oculi, that's what we put Botox in.
That's why we put Botox there. Yeah.
That's why Allergan's worth trillions of dollars,
Stopping that movement.
I mean, geez, we spend crap loads, billions, just to stop that muscle from moving and not give us crow's feet. The eye anatomy is actually very complex. If you watch if you listen to our rhinoplasty episode, which is one of my favorites and one of my favorite surgeries to do, the anatomy of the nose is very complex. The eye is almost the same. It's one of the most complex areas that we operate on. And that's why you definitely have to go to a specialist. We'll get to that too. Someone who's board certified and does these surgeries a lot. But the anatomy is difficult. And I'm kind of happy we didn't put a picture up because it almost is too confusing. But you do have skin on the outside. We all know that. And then underneath that, you have the orbicularis oculi muscle, which is this muscle that goes around your eye on the eyelids, all the way around in circumference. And when it contracts down, and that's why you get those crow's feet. It also helps with closing of your eye. But then you have muscles that are deeper inside there, past the fat that's underneath the muscle, that lift the eyelids on the uppers and can help close the eyelids on the lowers. It gets very complex. You have something in there called a septum. You have bone around your orbit that's all involved this, and tear ducts, and you have a lacrimal gland. You have Mueller's muscle, which is deep inside the eyelid. So very, very complex. It's awesome. It took me a long time in my career to really figure it out. And once you do, it's like relieving, because once you kind of get an idea of what's going on with that eyelid, it's really fascinating. And it's cool because you can do cool surgeries. One of the other functional surgeries to that point, just real quick, I just wanted to add this. Some people out there do have lid ptosis, or droopiness of the eyelid. That's a functional surgery. That what you do is you can tighten the eyelid, lift it up, you can advance the muscle, you can do different things to help eyelids that are droopy, and that can happen with age or with trauma. And some kids are born that way. You may have known a child that had congenital ptosis, and that's fixable too.
Yeah, that's absolutely, and that really leads in well to who is a candidate. And we kind of have jumped around it a little bit.
Well, okay, I'm going to come out here. I feel like I'm in an AA meeting. I'm a candidate.
Oh, me too.
Okay?
I'm a candidate.
My name's Jason Martin, and I have eyelid aging.
I have eyelid aging. I
Do you, Nils?
I think it frequently. I'm like, is it?
The mask does not cover up your eyes, unfortunately.
Is it time for my eyes? Yeah. And honestly, wearing a mask, I think we actually were talking to somebody about this. Like,
it's terrible.
It make your eyes look worse.
It's like
pushes
putting
up
effing neon lights on your eyelids. It's
That's all
terrible.
you can
They got to
see.
have glasses on.
Yeah, and it really kind of.
You do not have eyelid aging.
Oh, I do.
Really?
Yep. I remember going way back in time, and we worked together for 13 years. You used me as an example one day to show a patient like how tight the skin on my eyelids was, and I think back on that now. I'm like, man, that's good old days.
Yeah, youth is wasted on the young. We talked about that too.
It's not that good anymore.
I know.
Yep. No, you couldn't do that on me now. The person would be like, no.
So if you have evidence of aging of your eyelids, that's loose skin and fat, you're probably a candidate for this procedure. In actuality, people think you need to wait until you look like,
right, until the skin is literally
like you're like the
over
crypt
your
keeper.
eyelashes.
And I don't think you need to do that. So it's better specifically for facial surgeries to do them earlier rather than later. That's like Dr. Martin rule number 1. So just remember that. If you have problems with your eyelid and you're watching or listening to this episode and you're like, I don't know if I should do it, I'm telling you, go get evaluated, see if you're a candidate, because it's probably better if you do it earlier. Why is that, Amy? Why is it better to do it earlier?
Well, a couple of reasons. I think a well-timed blepharoplasty or eyelid surgery is probably one of the best things you can do to just lengthen out the amount of time you look good.
Right.
And we see patients all the time who had their upper eyelids done in their late 30s or early 40s who are now in their mid 50s, and they still look great. Like, it's a surgery.
We saw a patient like that today.
Yep. If you
her upper face looked really good, and I was, gosh, your upper face looks so good.
Your eyes look good.
Yeah. She goes, I got a blepharoplasty or eyelid tuck 20 years ago.
Yep, when she was like 38, 39. So timing it well really kind of gives you a little bit of an extra time period where you look good and look refreshed. Like, it keeps you from getting that more tired, aged appearance more quickly. Also, it's a less drastic change. So we're big fans of doing the subtle thing that kind of just keeps you looking good. I always say it's easier to slow down time than it is to reverse it. So if you can just kind of keep yourself looking good.
That was good. I like that. That's the second t-shirt I'm making.
Yeah. It's keep yourself looking good longer versus making a drastic change when it's already gotten really bad. Like when you can, fold your eyelid completely over your lashes and like, it can touch your cheek. You've maybe waited a little too long. That change is going to be really dramatic. It's going to be dramatic to you. It's going to be dramatic to people who see you. So more about keeping yourself looking
subtleties. Yeah, facial aesthetics is about subtle, natural, demure. If you're a female, if you're a man, it's about representing who you are from a masculine like features, and like waiting a long time is fine. There's a lot of patients we have that come in, their eyelids have a lot of problems. When we fix it, it's super easy to do in our practice, but I think hitting it earlier rather than later is better. So if you have aging on your eyelids, you have fat you don't like there, some loose skin, one or the other or both, then definitely you're probably going to be a candidate for this procedure. Who is not a candidate for this procedure is probably more important to say. It's people that smoke cigarettes, people that have diabetes. If you have a thyroid problem, specifically Graves' disease, and a lot of times we check thyroid labs, okay? If you have any dry eyes, meaning that, and in Colorado, this is a real problem. A lot of people have dry eyes. The ability inside the eyelid for them to make the lubricant that really keeps your eye moist it can be affected. And if someone makes less of that stuff, or the glands that are involved in that are dysfunctional, then they can have dry eyes. You're not a good candidate for an eyelid procedure. And if you want to do an eyelid procedure, you should go see a specialist with dry eye specialist first, and get their opinion. So we categorically I categorically say no to many people with dry eyes. Because I don't want to make that worse. Dry eyes is it's a bad problem. And I would feel terrible just doing an aesthetic elective procedure and making someone worse.
Especially if they have dry eyes and have had a previous eyelid surgery.
Right.
Like, that's a frequent thing we see.
A frequent thing we also see is people coming in who've had previous eyelid surgeries that want a full other eyelid surgery. And most of the time they need more reconstruction. They need aesthetic surgery. Now, sometimes we'll do little touch-ups and things like that. But the reality of it is a lot of times they need something greater than that.
Yeah. So I think that's always a good point to make, that knowing when you're not a candidate for something is almost as important as knowing when you are. But really, men and women are both excellent candidates for this procedure. We've can start this as early as mid-30s, and then there's really no top age limit for it as long as you're in good health. Like most surgeries, you want to be in good health. The great part is too, an eyelid surgery has a pretty quick recovery because it is,
small and contained and superficial.
Yep. And skin that is thin. So if, like Dr. Brown said, if you think you have eye aging, then maybe get checked out because you're probably a candidate.
Yeah.
And for women too, I think a big one is you start noticing that like you can't wear eye makeup anymore.
I hate that. When you put
your eyeshadow on and you open your eyes, it just completely disappears.
We get that every week. I can't, Dr. Martin. It's very serious. I'm like, oh, what's going on? I'm so nervous for you. What's going on? When I put my eyeshadow on, it just kind of messes up and I can't get it on there fully. And then what they all inherently do is someone listening to this does this, where you lift your eyebrow up and you close your eyelid down. You have to kind of spread it apart.
You have to stretch it out, and then when you let go, of course, then the eyeshadow disappears, or your mascara is like rubbing off on your on your brow bone. So
preach.
Yeah, if those are your problems, you definitely are a candidate. So
come on, ladies, we got to get on the ball here. We got to get eyelids done.
I know, right? So before we go any further, let's take a quick break to hear a word from our sponsor, and we'll be right back to talk some more. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly, and the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
Yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
You know, just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. You know, this podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
And we're back.
We're back.
Right. So let's talk about downtime and recovery. And in amongst this, let's also talk about OR or office. Let's talk about that first, because that does impact the downtime and recovery somewhat. So we talked that there are 3 options for blepharoplasty or eyelid surgery: uppers, lowers, both, skin, fat. All of those things, all those combinations could mean doing it in the office or being sedated and doing it in the OR.
So the reality is you can do everything everywhere. It's possible, physically possible.
Well, it's possible for the surgeon.
Yeah. So and a lot of people that specialize in eyelid surgery will do all the things in their office under local anesthesia. We do that. We can do that. Most of the time, and this is our helpful advice, the upper eyelids for sure you can do in the office under local anesthesia. The lower eyelids, especially if you're doing a transconjunctival approach from inside the eyelids, you have to numb up the eye and you have to put eye shields in. We can tell you in firsthand experience that some people don't like that.
Yeah, you can't see it all. Like they're titanium eye shields.
It's not like you have a lot of pain.
Nope.
It's just your eyeball is numb and you cannot see even though your eyes are open.
Yep.
And that can create claustrophobia in certain types of people.
Well, there's also a lot of pressure on the eyeball.
Pressure in itself too.
Yeah,
now,
which people don't like.
There's ways around that. We can orally medicate you, right? We can give you medications that make you kind of sleepy. But at some point you get into a safety concern of how much medication you're giving in an office setting. Now, the second level would be in the office with IV sedation, okay? That's FYI, no different than if you go to the operating room. There may be a difference in cost, but there's no different. When you go to the operating room or if you're doing IV sedation in the office, you're still getting something to change your sensorium and make you sedated, okay? Or asleep.
Sleep.
So don't be fooled when say, oh, I do it in my office, but they do it with IV sedation. It's okay. Now, a lot of the times when we do larger facial procedures, we obviously do that in an operating room setting with general anesthesia or IV sedation because that would be hard to tolerate under local. Sometimes if we're just doing isolated eyelid surgeries, we'll actually do it in the operating room, especially if the lower eyelids need a lot of work. And I don't want the person to move around too much. It's very delicate work. We're talking about millimeters. I need the patient to be extremely still, and that's hard to do.
Not blinking or opening your eyes, but it's sometimes tough because your eyes are like swollen and puffy, and like people are trying to keep their eyes shut, but they're numb, so they kind of can't. Like you can't really keep your eyes shut for us or do other things that might make it challenging to do surgery in such a small area.
Right. So it's possible to do them and all. It just depends on the surgeon's approach and also your ability to stay still while you're doing weird things around your eyes.
Right, and
the eyes are an especially weird place for people.
Well, because
we've had more people struggle with the eyelids more than anything else, it seems like.
Especially the one thing that really, really gets to people is when you have to push down on the eyeball. Like
and
it's
put pressure on it.
Very disconcerting feeling. It really is. Even though it's not painful per se, like it really bothers people. And there's some areas, and this is not to scare anybody, but it's hard to numb up some of these structures of the lower eyelid, especially if we're going into like pull out a fat pocket or something, like you can't really numb that. So there's sometimes brief seconds where you do feel some, you feel stuff.
That's the other part. So if you're doing it in the office under local anesthesia, which is definitely a possibility and safe, know that there are times where it will hurt for sure, but it's not, they don't last very long and you get through it. So it's all tolerable. If you're in any way squeamish, maybe if you're doing upper and lowers, I would lean toward IV sedation, something in an operating room setting or general anesthesia.
Yeah. And the uppers alone, though, are super easy to do in the office. And like,
yeah, the uppers are the totally different story on that.
The uppers alone are really easy.
How long do upper eyelids take us in the office?
I mean, from the time you make the first little injection to the time they're completely done is like 45 minutes.
I mean, in my mind, it's like 10 minutes, Amy.
Right, I know. Well, I mean, from the very first injection, we got to prep you, we got to
right. So the surgery part's probably about 20 or 30 minutes at the most.
At the most. Yeah. I mean, that really doesn't take long. And that's if you need to really go after a little fat pocket or something.
I think we said this last time. There was and I always remember this, you remember these patients where we did her eyelids and she was older. It was her uppers. And she was like, what the hell did I wait for? Like she was built up in her mind that this was like a liver transplant. Like it's the most terrible surgery ever. And it literally took me like 25 minutes. She was like, you're not joking. Are you seriously done? For real? And you know, the injection part of the local and the upper eyelids hurts, but after that, I mean.
Yeah, it's not even something we really prescribe prescription pain medication for. The recovery is not painful. So downtime and recovery from the uppers only is very small. You have sutures for 5 to 7 days and they're just in that little, crease of the eyelid essentially. It can be a little bothersome because it's, it's an irritating place to have sutures and it kind of pushes your eye down a little. So you might feel like your eye can't completely open. You're also going to be a little swollen and bruised. Bruising is really the thing that gives you the most downtime from this procedure, is that you're most likely going to be pretty significantly bruised. There's a lot of blood supply. There's a lot of movement of our eyelids. It's a delicate area. So they do tend to, they tend to bruise. Even with the very best surgeon in the world, you're going to bruise. So that more than anything, your recovery is social, or your downtime is social downtime because you're bruised, not so much that you're in pain even the day after.
So, I mean, why don't you just get those blue blockers? Those ones, big, old school, like old man, East Coast glasses.
Just get yourself some Jackie O glasses. You're fine.
Oh, yeah.
I mean, really, with sunglasses on, no one will know you had your eyes done.
That's true.
It's very easy to recover from in that sense. Recovery, the first couple days, we do want you to be icing regularly. It's important that you ice as instructed by your doctor. Because this area is extremely delicate, you actually do run the risk of freezing the tissue.
Yeah, that's really important.
Over icing is a bad thing.
Right. So 3 things. Keep your head elevated after surgery, preferably like 3 to 5 days? Or?
Yeah, I would say a week if you can.
Okay, 7 days. Secondly, ice. You don't leave the ice on for long periods of time, like 10, 15, 20 minutes.
Or
now
10,
again, if you're getting the surgery, please ask your surgeon for the ice application. Don't go upon our recommendation, but that's really important. But listen, ice is the way out of a long recovery. Ice is going to set you free here. And then after that, I think low stress, taking it easy. So if you are like somebody like me and you're like, oh, it doesn't hurt, I'm just going to do whatever I'm going to do. And you're like bending over and putting your head in a dependent position, raising your heart rate, raising your blood pressure because you're working outside or doing something you shouldn't be doing. That's going to cause massive swelling around your eyes. The problem with thin skin is that it doesn't have a lot to contain that swelling, and it will swell up big. I mean,
and it's kind of trapped in by the bone.
It's trapped, and the lymphatics there aren't as great. So
kind of counts on your sinuses to drain stuff.
Head elevation, ice periodically as much as possible, but with periods of it off, and then really maintaining your activity level, low heart rate, low blood pressure stuff. You should be good. You can above and beyond that, you can do red light therapy, you can do cryotherapy. There's so many different things that Amy and I do, but those 3 things, you do that, you're going to be fine.
Yep. Yeah. So other than that, we have our patients do a couple of weeks of no intense exercise, and that's just really to make sure that you don't have a postoperative issue with bruising or swelling or extended period of time where you're bruised and swollen. That's really it. The incision heals quickly. The nice part is if you do people who do just the lowers, like with that in through the eyelid approach, have no external sutures at all.
Nope.
They look amazing. I mean, they're like the next day, it's like nothing happened sometimes.
They can definitely have bruising, but sometimes you're lucky and you don't get the bruising.
Oh, yeah.
It's miraculous. Yeah. And they come in and they're like, oh my God, you're the most amazing surgeon ever. It doesn't even look like I had surgery.
Right. Great.
And I'm like, oh, thank you so much. Yeah.
Don't tell your friends.
Yeah. Don't tell your friends that because they'll come in and they'll all bruise.
They're going to be the ones that are bruised for like 2 weeks.
Murphy's Law.
The recovery is really pretty easy. Obviously, we use our eyes a lot to do everything. We depend on them to see. So if you do wear contact lenses, follow the instructions of your doctor, but we will have you not wear your contacts for at least a week until your sutures are out. And even then, maybe a little bit longer, especially if we do the lowers, it might be 2 full weeks before you can wear your contact lenses. So if you're like me and you never wear your glasses because even though you can see, you still feel blind with them on, just know that going in, you're gonna have to wear your, that honestly is one of the things that holds me back from doing my eyes. I'm like, I gotta wear glasses for a whole week.
I mean, I wear glasses.
I know, but I don't know how, like I put my glasses on and I swear I'm like, I can't see. I don't know what it is.
So, I mean, there is a possibility that maybe you need new lenses, right? With a new prescription.
Oh no, the prescription's fine, but it's because I like, you know, I'm used to being able to see everywhere I look.
Oh my God.
And like my vision's pretty bad. So if I look outside my glasses or down and I can't see, it's like, oh my gosh,
your brain
I can't
is
see.
sick. Your brain's sick.
So.
All right.
Recovery's easy. Ice. Keep your head elevated. Don't work out super hard for a couple weeks. You're gonna be just fine. So we have a great picture to show. This is at 2 weeks post-op, or is this 1 week post-op?
No, that's like months. I think months out.
Is it?
Yeah, I don't know.
Either way, it was 4 weeks.
4 weeks. Yeah.
That's right. It's 4 weeks out. Yes. So we have our photographer here in the room with us. So it's great. So you really see, and this is on a young patient. She's in her early 40s.
Yeah.
It was just getting a little bit of hooding.
Right. If you look on our YouTube channel, Jason Martin MD, this is a great picture because this is someone who had just a little bit of a change. Mm-hmm. We could show you pictures of people with tons of skin hanging off their eyelids, but that's not reality. Like what you want to see, what does the subtle change look like? This is it. This is what like doing a blepharoplasty, eyelid tuck. What's the other third term for it? I keep forgetting all the names. Whatever. An eyelid procedure on the upper eyelids, what it looks like, done in like a subtle way, and it's nice. It just opens up the eyes, makes the eyelids look better, makes the eye look more open and more awake and more rejuvenated. And
I think some of the subtleties is, and this is what I really see on myself. If you look at this before picture, you see that there's a very sharp angle down, like from the midpoint of the eye, like that lid really starts to come down heavier from there. And it just kind of lifts it back up so that crease is more symmetrical across. So the crease is a lot more symmetrical versus kind of really pulling on that outside.
Yep.
And, you know, especially in the United States where we drive on the left side of the road, we tend to have worse aging on the left side of our face. So that left eyelid tends to show a lot more of it a lot sooner. It gets more sun exposure. So it's more assault from the sun.
It's like a Sherlock Holmes thing where if you saw someone in the right side of the face,
right, like you're British,
with age, you're like, oh my God, you're definitely Australian or British.
They're from, like you are from,
or from Samoa.
You're from a country where they drive on the right side of the car. So this is a really great picture to show. This is just upper eyelid surgery. Looks great. Great way to show it.
30-minute surgery, local anesthesia in the office, 4 weeks afterwards. There you go.
Yep, no bruising, everything's good. You can't see the incision at all.
Yeah, there's tons of pictures out there what blepharoplasty looks like, and everyone's eyelids are different, as like pretty much everything else we do. So, you know, but just know that these things heal very well. This is only 4 weeks afterwards.
Our lowers look amazing.
Yeah.
All right, so let's talk about some alternative or conjunction treatments, and these are really things that should be done either. They can be standalone, but they can also be done in conjunction with a typical blepharoplasty.
This is where we're taking it to 2.0, right? So before, it's somewhat similar. Eyelid procedures really haven't changed drastically in the past 2 to 3 years. But what has is some of these other treatments that we're doing now.
Yeah, and a great one that we've talked about before is Accutite. And we've talked about being small and mighty. It is
like Yoda.
Like Yoda. Tiny but mighty.
Yeah.
But it's a great addition. We've mentioned before that you can treat areas about the size of the thumb. So if you think about what is a great size of the thumb is your lower eyelids.
Yeah, that's for sure.
Like that is.
Let me remove my hated glasses.
I think I love that you like your glasses. So many people do. You know, so it's a great.
I mean, so let's just talk about my glasses real quick because I have to get this out there. I don't have to wear my glasses, but I do because I'm a surgeon and it gives me eye protection.
Right, and it does help.
It does help. Yeah. I mean, I'm getting older, so my vision's not perfectly 20/20.
Well, so you're fortunate. Without my contacts in, I'm like a blind person.
So you can't see walking around or anything like that. I mean, could you walk from your couch to your kitchen without hitting stuff?
In my own house, yes.
No, like in a random place.
I wouldn't like it. It's like this. Imagine all that you can see all of a sudden is about this far in front of you.
Oh, that's not good.
No, that's clear. And everything else, you can see it, but it's very blurry.
Oh, no.
It makes you feel very claustrophobic.
I didn't realize that my vision was so much more superior than
your vision is far superior to mine. Like it is far superior.
I'm going to put that in my notebook.
Yes. I learned today my vision is so much better than Amy's.
I've known you for so long. I've never realized that you are legally blind.
Sucks. I mean, I'm not. It's so, when I talk to people whose prescription is like a lot worse, I'm like, oh my gosh, like, how do you function?
I know.
Like, I don't feel, and maybe it's because I'm very type A and I like to feel very in control of my surroundings.
No, I don't know who you're talking about.
I'm not happy seeing 5 feet in front of me. I need to see 50 feet in front of me at all times.
So I will tell you, so my glasses, I upgraded my prescriptions and I got them a little bit layered, just a little bit. And so getting that fineness within like 2 to 3 feet, like almost like perfect vision was just awesome. It feels like you have supervision.
Right. You feel like superhero. That's how I feel when I put contacts in. I'm like, this is my superpower. It's just provided by a tiny little piece of silicone.
All right. Sorry for the deviation.
So, okay. So now that we've realized that my Achilles heel is my vision.
I realized that when the apocalypse comes and you don't have your glasses, I am leaving you wherever you are. I am dropping you off.
I'll be huddled in a ball, like I can't see, like crying.
Like, leave her there. She can't see. Let's go, guys.
Close to us. Put it closer to her.
Leave her with some bread.
Right. Kicks the loaf close to me. Yes, I see how it's going to go down.
All right, let's talk about alternative treatments.
Yeah, so Accutite's really, really great for treating the lower eyelid specifically. One of the things that we kind of touched on with the musculature of the eyes, it's all really close. And that's what you don't really realize with the eyes. I mean, most of the body, you could have a cut that's pretty deep before you actually expose muscle. Whereas on the eyelids, that is not the case. We actually had a patient come in when we were on trauma call. The ER called so that it wasn't that bad, sent the patient over. I cleaned all the dirt out of it. And
went to
Dr. Martin's office, I'm like, there's exposed bone.
Yeah, like all her orbital rim was exposed.
Like it had gone through all the muscle.
It's good that they didn't even examine the wound. That's okay.
Right.
Sometimes people have hard days,
I'm like, this is like, and there was like actual gravel like ground into the bone. Like there was dirt I couldn't get out because it was actually like abraded into the ocular rib.
She was like, is it bad? And I'm like, well,
it's not great.
You got bone there still. I can tell you that for sure. I visually am confirming that your bone exists.
Yeah, so everything's really close. So when people ask if we can do Accutite on their upper eyelids, I mean, yes, you probably could, but is it the best place to use it? No, the best place is really the lower
eyelids. And so Accutite, which uses radio frequency energy, that's a great episode. You should go. We have an episode on Accutite.
We do?
Yeah.
Yep.
And that's also on our YouTube channel. So it uses radio frequency energy. It's manufactured by InMode. It's one of my favorite devices to use. Works underneath the skin. The radio frequency energy goes underneath your skin and through the soft tissue and skin, meets resistance, creates heat, melts fat, and tightens the skin at the same time. So you can definitely use it on your upper eyelids, but it works better on the lower eyelids because the fat pockets there are usually more of a problem. So you can not only treat the fat pockets, but you can tighten the skin at the same time. Yeah,
and it gives a nice improvement in just the kind of tone of that lower eyelid skin.
Yep.
Especially for people who are like on the verge, like you don't have enough excess skin that it's worth going in and actually excising that skin,
and
or
you don't want to go through the whole rigmarole of blepharoplasty, eyelid tuck. Accutite's a great
really good option.
Yeah, middle option. This came out a year or 2 years ago. It's one of our specialties. We love it. There's not many other devices like it. So you can go on the internet and find, maybe other options besides Accutite. Probably not going to find much. But I'm sure they're coming out. So this is a great tool. I mean, we use it all the time. We did a case today.
Yep, did a case today. And it's really—
on the lower eyelids.
It's really, I mean, we were talking about blepharoplasty surgery being easy. I mean, this is even a step easier.
Yeah, that was 25 minutes.
It's super fast.
With local anesthesia.
You numb it up, you do it, and you're done. There's not even a need for a suture because it is so tiny. It's literally the size of an 18-gauge needle.
Yeah, so you have a little poke,
a tiny
in your
poke.
Skin, just like you would get with an IV, and within 3 days you don't see it.
Yep, you don't. I mean, even by the next day, sometimes it's hard to perceive. Now you can bruise with this also. Anytime you're injecting into that lower eyelid, you're probably going to bruise a little, but the bruising is typically less than with a regular blepharoplasty, but can still absolutely be there.
Right.
So Accutite is really good for treating that kind of loose, crepey skin on the lower eyelids that's not really ready for actual excisional surgery or just premature aging of the eyes. Like it can be helpful for treating some of the wrinkles and just that kind of textural appearance that changes as you age. Laser treatments are another good option. Now, Accutite works underneath the skin. Laser treatments or radiofrequency treatments that are ablative are going to work on top of the skin. We've talked about this in our skin tightening episode. Basically, your percentage of improvement is going down with each of these things. So Accutite's treating deep under the skin.
Which is going to work way better.
Right. Surgery is obviously definitive. Accutite is your next step down.
About 50% less.
And then we get to laser treatments.
Which is like 10% of regular surgery at the most.
So very minimal change. But laser treatments and any topical treatments like Fractora or Morpheus, Viva, any of these heat-based treatments on the surface of the skin are going to help with the texture, discoloration, fine lines. They're really additive. They're not a standalone.
Right.
They're preventative, they're additive, they're maintenance.
We're bursting the bubble of every dermatologist out there.
Oh, no, we're not. They're like, yes, heck yeah, these are maintenance.
Oh, okay.
Yes,
yeah,
they're maintenance.
Yes,
yeah.
maintenance.
You know, they really are.
Whatever fits into the business plan.
Absolutely. They're maintenance. Yeah. They're like Botox. You aren't going to not need Botox after your blepharoplasty. You're not going to not need laser treatments to address things.
That's true.
So they're really great add-ons.
Yeah. You could do a blepharoplasty. You still need laser treatments of the
exactly,
skin.
to keep that skin healthy. Yeah. And then we get all the way down to, we talked about this again in our skin tightening episode, is just topical things in general. So under eye creams. My favorite for kind of treating the primary things that people complain with under eyes: dark circles and bags. And then wrinkles. You know, those things that trifecta. So,
which is a common complaint. So besides the mayonnaise that you put on your breast when you were 14, you revealed that during the, what episode was that, Nils?
That was
breast enlargement.
Without augmentation. Yeah. Yes.
So I don't know what was going on in your childhood, but besides mayonnaise on your breast, what would you recommend for dark circles? What would you recommend for puffiness, et cetera, et cetera?
So dark circles, vitamin K cream is actually your best bet. So vitamin K actually helps break up those platelets. If what you've got going on there is just some like trapped platelets underneath the lower eyes, giving that really blue or darkened appearance, it can really help brighten things up.
What about for people just naturally, congenital, genetically have those tear troughs that are pigmented? What about using Triluma on that or something like that? It's not going to penetrate down in there. It's too deep.
It is, and that's a different story.
The creams that people, what do they call it? The patient asked for today.
Like a hydroquinone.
No. The creams that bleaching kind
That's
of creams.
hydroquinone.
Yeah, hydroquinone. Yeah.
Hydroquinone is really meant to bleach like brown spots on the surface. You can't bleach out the darkness. So you can treat it with like vitamin K by getting in there to kind of penetrate and break those platelets up. But doing a topical bleaching agent is not going to be effective. So what can be effective, in addition to doing some vitamin K cream, is actually putting very modest amounts of filler can actually
I was going to say that actually
plump that skin up a little bit so it doesn't look as dark. You kind of
fillers in the tear trough. The tear trough is literally what you think it is, where your tears roll down. Okay, that dark area that everyone hates near your nose. Fillers work great in there. And I actually, if you go to someone who's a little more savvy with the facial aesthetics, I'm biased. I think it should be a surgeon, but someone who's really good with injecting on the face. They can inject all around your eyes. I do it all the time, and it makes a big difference.
It can.
So you can avoid the need. You can make your eyes look better and avoid the need for doing definitive surgery with fillers.
You can. Some people can.
Well, it only lasts a year.
It's not going to work on the uppers.
Yeah.
And they do go away.
Yeah.
Some of the other things that are great for treating the area around the eye is caffeine. So if you really have a lot of like puffiness but not so much darkness, caffeine is a temporary fix. Like it will reduce the puffiness on your lower eyelids.
So can you just take coffee grounds and rub them on there?
Right? No. It would be in like in an eye cream that's specifically meant for puffiness. They almost always have caffeine in them in addition to other things, but it's the caffeine that really helps kind of make that area look not so puffy. Retinols, gentle retinols, to help treat the texture and also the fine lines around the eyes, are a really good option as well. So those are the three things that are actually going to...
What about the old school treatment of hemorrhoid cream on the...
Preparation H?
Preparation H.
That just causes the skin to contract. So will that maybe make your eyelids look slightly tighter? I would not recommend putting Preparation H near your eyes, but and actually I've heard that they took whatever caused that skin tightening out of Preparation H now.
The company did?
Mm-hmm.
What idiots.
Yeah.
Are you kidding me? I would have kept that in there. I would have been like, I would have rebranded.
Preparation H for eyes.
Preparation E.
Preparation E.
Preparation Eyelids.
Eyelid. Yeah. So there are some topicals that can definitely treat some of the concerns around the eye, and especially if you start them young and do some preventative treatments. There are some eye creams that claim to be like Botox, like mimicking like Botox effect that kind of cause some of that paralysis.
Creams. Yeah, there's definitely creams that tighten the skin too. Like temporarily, I mean.
Yeah, and that do kind of cause that temporary paralysis of the muscle. But one of the things we didn't talk about, we were talking about Botox for around the eyes. Part of the reason why you can never completely knock out your crow's feet is because what's causing that is actually movement from the zygomatic muscles up, because they pull up on your cheeks.
Oh, that's a good point.
So that's part of it. Like you can Botox all you want.
When you really smile, everyone smile right now.
Smile big.
Yeah.
Like smile
you get those big cheeks going up. Yeah. It's so funny because people come in, they're like, look when I really smile. Look what happens to my crow's feet. I'm like, listen, smiling's good. Smiling is good for your life. Everyone, especially after what we're going through this year, everyone needs to smile a little. And so you can't knock out the zygomaticus major and minor muscle that lifts the edge of your mouth that allows you to smile. If you do knock that out, you will look weird because you will walk around emotionless. Yeah. And people will stare at you.
You'll have no crow's feet, but you literally will also
But your crow's feet will be
smile.
flattened out.
Yes. So there's more at play there.
I like the fact that we're entertaining Nils on this episode.
Yes. So another great picture here. This is actually a patient who, in her pre-op picture, to be completely transparent, she had an upper and lower blepharoplasty. However, she still just had a little bit of that puffiness of the lower eyelids that was not fully addressed, even with her lower eyelid surgery. So about a year after her eyelid surgery, came back in and did Accutite. And you can really see what an amazing change that
if you
made.
look on Jason Martin, MD, you can see an enormous change in the lower eyelids. That is Accutite, a 25-minute procedure with local anesthesia, minimal to, I mean, it's like small little teeny stab incisions and you won't see it.
Yeah.
Remarkable change. That's where it's going, less invasive options, but it doesn't, as much as we love Accutite, it doesn't replace actual surgery.
No, and for this patient, like I said, we're not the type of office to be like, look what Accutite did, when she actually also had a upper lower blepharoplasty. But the Accutite really was a great finishing touch to kind of really get that last little bit of skin tightening on those lowers and get rid of that puffiness. So, and she's young. I mean, she was in her early 30s, so yeah, she's had some premature eye aging, so it's a really good option.
I think we blew it out with 2.0.
We did. So there you go.
So I'm glad we redid it. We got to introduce Accutite. We also found out that Preparation H is does not have the secret formula to make swelling of the lower eyelids go down.
Yeah. So if you're at all considering a blepharoplasty, we definitely recommend seeking out a board-certified plastic surgeon or an oculoplastic surgeon who specializes in surgery of the eye.
We talked to a patient today who listened to like half of our episodes, all of them. And she's like, the first thing and foremost I want to tell you is I am going to a board-certified surgeon. Right. So I was like, thank you. Thank you for listening to us. It's so important. Let me just tell you something. Eyelid surgery is one of the most complex things we do. If you listen to the rhinoplasty episode, I said kind of the same thing. You need to go to someone who does these surgeries a lot. We personally do them a lot in our office. But there's a lot of plastic surgeons that are excellent that don't do these surgeries, okay? And that's okay. It doesn't make them bad surgeons. This is not their thing. It's not their specialty. Or even ENT surgeons. Some don't do this stuff. Or ophthalmologists. Just because you're an ophthalmologist doesn't mean you do cosmetic blepharoplasties. Don't be fooled. Make sure that's their specialty. If during the day they do cataract surgery and at nighttime they do your blepharoplasties, I have a problem with that. Okay. I'm not saying your results won't be good, but just be a good, smart, educated consumer. It's really important. Find a specialist that does these surgeries. If you do, you're going to have a great result. Take care of yourself after surgery. Don't overexert yourself, and it's going to be an awesome result.
Yeah. So thanks so much, everyone, for listening to Blepharoplasty 2.0. We do appreciate it. I have a special request for anyone who watches us on YouTube. If you would be so kind as to subscribe to our YouTube channel. We are trying to get a merchandise store going, but we can't until we have 1,000 YouTube followers. So if we get
all the t-shirts we talked about this episode,
all the
are going to be in this
like
merchandise
squat
store.
ladies, and
we're going to have like 20 t-shirts
and mugs. So if you would at all be inclined, we would love the support. You can also follow us on Instagram at Beauty and the Surgeon Podcast, and of course on YouTube at Jason Martin MD. And you can leave us a voicemail if you want to reach out to us and leave us a question. That number is 303-630-9038, and that will be in the show notes. We're also going to start timestamping. So if you made it this far and you missed a spot, look in the notes. We're going to try and start timestamping. Yep. So thank you so much, everyone, and we will see you next time.
Bye.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.